Hi guys, welcome back to my channel. So in this video, I'm going to introduce to you guys the Littman Stethoscope that I have. This is Littman Cardiology IV Stethoscope. I bought this one a year ago before the start of my first semester of nursing school. I know it's gonna I think it's around $200, but I didn't really mind buying a higher price stethoscope as long as it would be durable, lasted forever, and lasted more years, and then it's going to detect more sounds that are needed for assessments, right? So this one, a little bit of background about the Littman stethoscope. It was invented by Dr. Littman, David Littman, back in 1960s. I'm not sure if he worked in Harvard Medical or he studied over there. But yeah, that was the guy who invented the stethoscope. And then he aimed to be creating a stethoscope that's more durable, lightweight, and able to be adjusted so that the nurse or medical provider can hear sounds. So over here, this is the packaging. It's 3M also. 3M kind of gets me because in the Navy there's 3M acronym as well. But over here, some specs over here. The stethoscope has a diagnostic stethoscope with outstanding acoustic performance, single piece tunable diaphragm that will allow the healthcare provider to hear audible high and low frequency sounds, easy to clean, single piece tunable diaphragm, versatile, for adult and pediatric two-sided chest piece, and then dual lumen tubing provides two sound paths in one tube, so you can hear in both ears. All right, let's open this one. So yeah, I kept the box also because again, if I store this one, if I'm not using it, I have two stethoscopes. So this one is like a special one, if for special, it might be the actual, when I'm actually licensed as a nurse, I'm gonna use this one. The other one is more cheaper, so I'm using it for just for class purposes. So these are the piece, earpiece comes along with the stethoscope. But when I first started, nursing school, I have no idea of how to use this one or what are the parts of the stethoscope, right? So this is the earpiece over here, and then of course the tubing, the clamp over here. There's going to be a clamp over inside, but the most important thing that you have to know if you're using a stethoscope is the diaphragm over here, the drum, and then the bell side of the stethoscope. So whenever you're hearing or trying to hear heart sounds or lung sounds on your patients, right, you're gonna use this one to hear it. So, but again, before you even use this one, make sure you kind of wipe it out, make sure it's clean, but don't kind of pump it if you're already putting the ear. The thing in your ear because it's going to be loud. So, and also, you're cleaning it before using it prevents infection because you don't want to transmit any bacteria to a different people, because again, if you're touching a different patient, they have condition that might be transferable to, or infection that they can move to other people. All right, so this one, the diaphragm, would help you to be able to hear the usual S1 or S2 heart sounds, which is the lub-dub of the heart, and also you can probably hear the abnormal heart sounds too, which is the S3, S4. This one, the smaller circle over here, which is the bell of the stethoscope, is special because again, it's low frequency, so it's able to hear low frequency sounds on the person, and it means that in the example brewies, swooshing sound, so you can hear kind of water. I've never heard it on an actual person, but that is the explanation that they gave us in school. So it's kind of awesome though. So he will be able to hear it. Over here, the earpiece over here. So make sure if you're wearing this one, that it's gonna be like in a position like this towards your if facing this one, because like you want the earpiece to like be in line with the ear canal, right? Because if you're doing it like this, it's basically hitting your ear, the back of your ear instead. So you're not gonna be able to hear anything. So it needs to be like this when you're wearing this one. So yeah, so basically that's it. So that's the use of the stethoscope, and it's really cool though. So over here, there's a booklet. I'm guessing an instruction guide. I've never really opened this one since I bought this. Let me see what is this one. So I didn't really bother to like open this one last time, because I mean it's kind of like simple to actually use. As long as you know to use the diaphragm and bell and then the earpiece, you should be fine. So but this one, all right, there's pictures over here. It tells you also like proper wear and proper care as well. Like, so this one, it was saying in picture over here that this is the extra piece for that. So example, if you want to replace the I think yeah, so this is the extra piece for the bell. So if you want to, if it gets worn out, you can use this one, and the other two would be for the earpiece as well. But that's it, guys. Again, the design is cool too, so you can see some info. So I'm kind of excited again because we're gonna start nursing school this this month now. So I might need to start reviewing how to use or do some assessments on patients. But all right, guys, thank you guys for watching the video. Take care.